All right. So welcome everyone. Thank you so much for dedicating your time to helping our students understand a little bit more as they begin their journey on whatever nursing, healthcare, or otherwise career path that they're going down. So we're going to start off by having our panelists introduce themselves. So if you can tell us your name, your job title, how long you've been in your current position, and what degree or degrees you currently hold. And Laura, I'll go ahead and start with you if that's all right.
So we're going through all the questions or just the introduction?
Just the first one. We're going to do a round robin.
Perfect. Okay. My name's Laura Milligan. I'm a nurse practitioner. I've been a nurse for, I think, at least 12 years, or a little bit around there. And I've been a nurse practitioner for 7 or 8 years. And what degree? So I'm done with school for now. I'm not working on anything else. I am an RN first, and then a nurse practitioner in family and specializing in family, and then I specialized in pediatrics as well.
Awesome. Thank you so much, Laura. Valerie, did you want to follow up?
Sure. Hi, everyone. My name is Valerie Seng. I am the program director for medical assisting over at San Diego Mesa College. My career path started with being a respiratory therapist, and I have been a practicing respiratory therapist since 1995. So we can do the math there. So maybe 29 years. I have an associate's in respiratory, and I also have a bachelor's in sociology and a certificate in primary care as a primary care associate. And that's it.
Wonderful. Thank you so much, Valerie. Sarah?
All right, and this is just so I'm clear, this is a community college, junior college group on this call. All right, so I'm gonna go way back. So I am Sarah Pretanvil from San Diego, Southeast San Diego, from the community and for the community. I am a social worker, a registered nurse, and an epidemiologist. I have 3 associate's degrees, so that's why I was saying I was gonna go way back. I have an associate's degree in social work, an associate's degree in biology, and one in liberal arts. I transferred over to San Diego State University, and I was able to work with my associate's degree. So I want to encourage you all to make sure that you guys are, on your academic path, that you're not ruling that out as an option and as a part of your continuum of education. I also have a bachelor's degree in health sciences with registered nursing and public health as my 2 main focuses. And then I did a post-bac program at Harvard Medical School in clinical and translational research. And then I obtained my master's degree in public health epidemiology at San Diego State University. I am currently, let's see, my job title. I'm currently the director of nursing for San Diego PACE. And how long I've been in my current position, I actually just promoted to this position after being the manager for the state of California Department of Healthcare Services for all patients in the county of San Diego for Medi-Cal waiver. I was the manager of that program for almost 5 years. And so I just promoted to this position as director of nursing for San Diego PACE, again, managing all patients in San Diego on February 1st. So I've been around the block a few times, and that's all of that. Yeah, and I don't think that I'm going to go back to school anytime soon. Maybe a PhD. I keep toying with it, or a JD. We'll see.
I kind of feel like you've done enough,
I've done my part.
You have.
A lifelong student. I've done my part.
You've done plenty. Can you tell us what PACE is?
Sure. So PACE is the program for all-inclusive care of the elderly. A lot like Laura, I actually started out as a peds nurse and absolutely love it. And so now I'm on kind of the other end of the scale, so 55 and up. And these are individuals who have some limiting health conditions that really require wraparound services. So PACE includes, remember I said I'm a social worker and a nurse, and so PACE essentially looks at the health data to find out what the best practices are. And we have a whole team, doctors, nurse practitioners, physician's assistants, registered nurses, medical assistants, Valerie, medical assistants, respiratory therapists, physical therapists. The entire team is with PACE, and the team provides 100% of all of their care every single day. So meal deliveries, wound care, social work, housing resources, food, whatever you can imagine to keep someone healthy. That's 100% of what we do all the way around, holistic care for all of our patients.
Wonderful. Thank you so much. Yeah, that's a big job. And perfect timing, Sarah. Sorry, Sarah, we'll call you Sarah S. I'm sorry, I know it's kindergarten style, but we have two Sarahs. So, so Sarah, we were starting with the introduction. So your timing was perfect. So if you want to introduce yourself.
Yep. I apologize for getting on a few minutes late. My computer was giving me a heck of a hard time, so I ended up on my phone. So my name is Sarah, like she said. I am a registered nurse. I just graduated in December, and I started my position as a registered nurse a couple weeks ago, actually. So I'm still in the orientation phase. Those feelings of, hey, this is finally real, or, all over the place, but it feels great. I graduated in December with my associate's degree in nursing. I do hold 2 other associate degrees from my prior education at community colleges. And I will be starting working on my bachelor's degree over the summer. So lots going on still.
The journey never ends. Awesome. Wonderful. Thank you all so much for being here. Okay, so speaking of the journey, so Sarah, since you're in the crosshairs already, I'm going to start with you on the second question here. So did you start your academic journey knowing that you wanted to end up in the job you are currently in, or did you pivot? If you pivoted, what did you pivot away from and why?
So I started my college journey fresh out of high school. I think, I came from a family who didn't have any college experience. So me and my sister were the first ones that, were going to college. And so my mom kind of just thrust me in there and was like, I don't care if you know what you want to do, just start classes. So I feel like I kind of wasted some time early on, just, getting a lot of classes I didn't necessarily need, but I did know pretty early on that I wanted to be in some type of medicine. And the more I looked into it, nursing just kind of sparked all the feels. And I was one of the weird ones that just loved being in hospitals, and around medicine and all things medical. So I did know early on that that's kind of what I wanted to do. And once I got on the path, I was able to really focus my education on what I needed for that. So yeah, I don't think I really pivoted, but I did have to kind of gather myself and go, okay, now that I know that I do want to do nursing, I have all these random classes. How can I focus my education to get on the path that I need? So, yeah.
Wonderful. Thank you so much. Laura, did you want to piggyback off of that?
Yeah, so I'll try not to talk too much, but because there's been so many changes. But yeah, at first when I was really young, wanted to go to med school, and then I learned a little bit about like what that even means, internship, residency, fellowship, and how kind of like hard it is to pivot when you're a doctor versus a nurse. And I didn't even know what a nurse practitioner was. My dad was like, maybe you should look into that. Like it's a different way, but it's kind of puts you in that similar path where you can still prescribe. And so that shifted me to nursing school. Also, I met this one doctor in high school, and she was like, well, if you want to go to medical school, say bye to your 20s. I don't know why that just scared me. I was like, I don't want to say bye to my 20s. And I know maybe that was bad advice. I don't know, but I'm happy where I'm at. I'm really happy. So I went the nurse practitioner route. And then I had no idea what I wanted to do, but my senior practicum of nursing school was pediatric oncology. I don't even know how I ended up with that. Sounds really depressing, kids with cancer, but I ended up really liking it. So that's just the senior practicum that I got randomly assigned ended up being my like identity for 12 years as a pediatric oncology nurse. Realizing that it is depressing, but it's also an honor to take care of these kids and also um since the 80s things have gotten way better. Like a lot of kids with standard leukemia survive. So it's not as like depressing as you would think it is, but brain tumors are still there's still two cancers that we aren't good at, but there's kids that I've taken care of since they were like really, really young, and now I know them as teenagers and even young adults, and it's just such a beautiful thing to be able to see somebody thriving after they were so sick. So it's a really cool field. Wouldn't recommend it for everyone. Um, and then I became a nurse practitioner, and then I started working for Doctors Without Borders, and that was, yeah, that's quite the life commitment that I think people don't realize. You don't just get to like disappear for a few weeks and then come back. They're long assignments and it's hard to get into. If you want to work for Doctors Without Borders, let me give you one piece of advice. Learn French. It's really, really hard to get in. And if you speak French, then you have a huge leg up. That's one thing I didn't realize how important it was. So I've been pivoting my whole life, just left and right. I don't really know where I'm ever going, but now I'm here at Mesa Community College in the Student Health Center, and I'm kind of chilling out a little. So it's great. So there's so many options. You can go from like, I worked in Ebola, in West Africa with no AC and, suffering to like chill job at a community college and a health center. So there's so many choices. Okay, that's my answer.
That was beautiful. I think that this is one of the things that is so wonderful for students to hear is this versatility, and that you can follow a passion until it becomes maybe more work than passion, and then find something that sparks you again in a new way, in a new area. So yeah, absolutely tremendous. Thank you so much, Laura. Sarah P, sorry. Do you want to follow up on that?
Oui, je suis Sarah Pretanvil. Pourquoi? I am Sarah Pretanvil because I also did international. So I was pursuing a PhD in global health, and I ended up going after the earthquake to Haiti, and ended up marrying the young doctor that I met while I was at Harvard. And so we have a daughter, Naira Pretanvil, and that's why I'm Pretanvil. And so we did international work. He's an infectious disease physician. He also was in Sierra Leone and other places. And so, doing all kinds of responses for like Médecins Sans Frontières, like Doctors Without Borders. This program is Amis La Santé, which is Partners in Health. And Dr. Paul Farmer was the lead of that. And just my amazing, you're shaking your head, Laura. He's a superhero for anyone in public health and medical fields for international public health work, international work. Anyway, I wanted to be I wanted to be a nurse. I grew up very poor with food insecurity and housing insecurity and clothing insecurity here in Southeast San Diego. And we had one person in our neighborhood that had a really nice car. It was a 4-door Honda Accord. I'll never forget it. And I was 12 years old. And I was walking down the street and she always had on her scrubs and her hair was perfectly coiffed into this style. And one day on the way to 6th grade, I said, "What do you do?" And she said, "Honey, I'm a nurse." And I knew in that moment that I was going to be a nurse. And so I graduated from high school at 16 and went straight to community college, first person in my family to go to college, and failed chemistry and decided, oh my goodness, maybe nursing, the chemistry is required for nursing. Well, maybe it's not for me. And so what came very naturally to me were the social sciences. So that's how I ended up with the associate's degree in social work, was that came very naturally to me. And so I got a job with the County of San Diego as a social worker. And so that's what I started doing. And what changed my position was someone believed in me. Prof. LeBoff at San Diego City College, Michael LeBoff, Professor LeBoff, was my mentor, and he believed in me, and he introduced me to people that were going to help me and were not going to let me fail. And so I passed that darn chemistry class, and then microbiology and anatomy and physiology and every other, OChem and all the other things that I needed to do. And here I am. So I certainly have pivoted a lot. The joy of where I am now is that I get to use my social work skills that I acquired over those 5 years with the county. And I get to use my clinical skills to assess clients. So there are social determinants of health that really affect, people's access to care. And I'm able to see those things. I have a ton of resources because of the social work. And then I have a ton of clinical skills. I can assess patients as well and offer recommendations. So kind of creating that same holistic view that we talked about earlier with PACE, but I can do that on a really broad scale. So lots of pivots and turns, but definitely doing what feels right in my heart.
Wonderful. Thank you so much. And I think that your experience about why people get into healthcare, so there's so many different reasons of the why to get there. But the ability to give back to your community and come back to the places that you grew up and help people is really just so meaningful. I think being able to come back here, right? So yeah, no, that was part of my journey as well as a chemistry teacher. I'm sorry. I think I'm one of the good ones. I hope. I don't know. Don't. But yeah, so but no, it can be so challenging, and it's hard when you don't have the support of a family that understands what you're going through, right? There's, nobody in my family was ever able to help me with a chemistry problem, right? So I'm sure you guys are probably in similar situations. So yeah, no, it can be challenging, but yeah, finding that mentorship, finding the people who will lift you up and support you on that journey is huge. So wonderful. Thank you, Valerie. Sorry to leave you to last. I always feel bad for that, but you want to share with us?
I unmuted myself this time. So my journey, very similar to Sarah, I also grew up in poverty, and I also, as many of our students are first generation in college, don't have anyone who has any knowledge as to what classes to take or what to do, what have you. And so when I graduated high school, I wasn't quite sure what I wanted to do. And so when I started college, I started off at Grossmont Community College. I started taking just general education courses. And at the time, I was recruited to be an interpreter for the Union of Pan Asian Communities, for UPAC. And I worked in HIV education as someone who did outreach, or as a health educator. And then I kind of moved a little bit over to alcohol and drug treatment and domestic violence. And during that time, while I was working, I decided I wanted to get into healthcare. And Grossmont has an allied health department. And when I went over to visit, there was nursing, there was cardiovascular tech, and there was respiratory therapy. I felt that I wanted to do healthcare, but I wasn't sure I wanted to do nursing. And after sitting and speaking with the secretary for respiratory, it really piqued my interest. I went ahead and applied, and the following week I started school, and I never really looked back until a few years earlier. And so I worked as a respiratory therapist for a number of years, and I loved it. I mentored new grads. Working at UCSD, I worked with a lot of medical students and interns and residents, and I talked to them about mechanical ventilation. I talked to them about COPD and how to manage patients on ventilators, and just a bunch of things like that. And I got really interested in the teaching aspect of it. I also taught BLS and ACLS. So anyway, long story short, I picked up an adjunct position in medical assisting. They really needed someone to teach EKG, electrocardiogram, and teaching the arrhythmias. And one thing led to another. I taught that class. I also taught medical terminology and pathophysiology. And the opportunity came up to be to apply for the program director for medical assisting. So I did, and I got it. And during that time, we hit the pandemic. And some may not know this, or maybe some do, but as a respiratory therapist, we are one of the only people who go into the rooms with patients with coronavirus. And we are in that room with them for up to an hour at a time, giving them treatments, helping them breathe better, ensuring that their oxygenation is up to par. And I guess I would say that the timing was right for me to be burnt out from bedside and to pick up a new love, and that was education. So that is how I pivoted into where I am now.
Did you actually, were you working in respiratory care alongside of being an adjunct before you got the program director? So during Corona?
I was, and
Gotcha.
actually, it wasn't until recently that I left bedside.
Okay.
So I've been the program director now for a little over, I want to say 3 years, and it's only been recently that I left bedside. It was just, aside from it being too much to juggle,
Sure.
working in the hospital and also running a program, it was just time for me to leave bedside.
Yeah. I have to imagine that you know, it sounds like most of you have some pretty traumatic experiences in areas that you've worked. That's a question that I didn't put in here, but I would love to hear how you handle that. I mean, it sounds like maybe Laura, you kind of mentioned that pivoting is maybe part of that strategy. But what other kinds of mental health wellness, self-wellness do you have to do to be able to work in a field like this?
For me, I will say that my very first job as a respiratory therapist was in a long-term ventilator facility. So we had patients there who just would not be able to come off ventilators, and without the ventilators, they wouldn't be able to breathe. And so that was kind of sad in and of itself. And I did that job for a couple of years, and what it taught me was the cycle of life. Even though these patients were considered long-term ventilator dependent, many of them did eventually come off the ventilator. And so I saw the bright light in that. And I made a lot of strong connections with my coworkers, other fellow respiratory therapists, other nurses, critical care doctors. From there, I went over to UCSD, and UCSD in Hillcrest, I'm not sure many know, but it's incredibly busy. As a respiratory therapist, we worked everywhere, from the emergency room to labor and delivery to the burn unit. UCSD has the regional burn center. So all the burns within the 100-mile radius, I believe, would go there. And we also had trauma. And so for me to talk about my traumatic experience, I think I was ready, more or less, or I don't think you're ever prepared for a global pandemic. But I did understand that death was part of healthcare. And my understanding, or from what I gather from speaking with people who do not have as much experience as I have, and the type of experience that I have, it was quite daunting for them to work during the pandemic. Whereas for me, I understood the physiology of it. And I understood that, okay, if we don't get to one point or another, the patient may not survive. And I prepared myself for that likelihood.
Did Laura or Sarah, do you want to get in on that question? So let me rephrase. So like how do you deal with the weight of the job that you've taken on?
So I just took myself off mute. I thought I had learned when I was getting my associate's degree in social work. I had a teacher, Marty Dare, who told me to cloak myself. If you can imagine, it's a rainstorm outside, and so you take this big rain hat, a big yellow rain hat, and you cover your head with it. And then you take a big raincoat and you cover it. It's like the plastic kind. And then big galoshes, and you pull them all the way up to your thighs. And so before you walk into someone's home, or I ended up transferring that over to a patient's room or a healthcare setting, but essentially every single day I would don my imaginary raincoat and my big hat and my umbrella, and so when I walked in and it just poured down on me, it would essentially just kind of wipe off and wash off of me. And that's an analogy that I've shared with students as I've taught nursing. That's an analogy that I've shared with my nurses that I've led over the years at UCSD, Valerie. And so that's kind of what stuck with me. And I'll tell you, last year I was driving on the 805 freeway, and there was a multi-car accident, fatality, and I was on the freeway giving CPR. I'm also a CPR instructor and ACLS certified and all the things. And I was on the freeway giving CPR and just working really hard on this woman. And she didn't make it. And I was crushed. I was just inconsolable. And I mean, I've seen hundreds of people die. And my brother, who's a fire captain, said to me, he said, Sarah, the greatest gift that you can give someone is to be your very best when you're with them. You can't guarantee them life, but if you can have improved the last moment of their life, then you've done your job. You've done what you came there to do. You can't save them all. And so that's what I apply now. And it really has just been, I know that I'm not going to be able to save everyone. And I think I always knew that, but I just needed a reminder. The yellow raincoat was so good, but that I improved that woman's life. She had someone trying to save her. And the last breath she took, she had someone really working hard to make sure that she was going to, and she wasn't alone. I did my very best to make sure that she had quality in those last breaths. And so that's how I look at everything now, is just to make sure that I'm coming in with my full heart and the very best of me with every single interaction, to make it just that much better, because we never know.
That's beautiful. You guys are inspiring me. I'm gonna cry. Laura, Sarah, I'm sorry, Sarah, I saw you took yourself off mute. Go ahead.
Yep. So I think just from the perspective of, handling the stress and the role of what we've taken on, even like at the nursing student perspective, getting into nursing school, getting through school, you're still working with patients on a daily basis. The stress of school and bedside patient care can quickly get overwhelming. It kind of encompasses your whole life at a point. And if you have, family, if you have children, if, everything outside of school kind of builds on that. And one thing you learn very quickly is the importance of self-care. And even, our nursing professors tell us, even if it's just 15 minutes outside to take a walk, or, stepping in a quiet room for 5 minutes and taking deep breaths. If you're in the patient setting in a hospital on clinicals, and you're dealing with, some really heavy, patient stories that are, sad, and it's hard not to, take that and assimilate that on yourself as a nursing student. When you have patients that you've been caring for pass away, it's hard not to take that on yourself and get overwhelmed. So you just quickly learn self-care. You learn to be kind to yourself. You learn to take, little bits of time to devote to yourself, to read a book, to do yoga, meditation, something that is going to be your outlet so that things don't kind of pile in on you. So I think that's, from a new nursing student or new nurse perspective, it's something that is very important.
I think everyone said it really well, like accepting death. That's something the whole society we could all improve on. And being present in the moment and the self-care. I really think everyone pretty much said everything. The only thing I could think of to add is like your coworkers and your fellow nurses. Like, you have to get together outside of work and you have to laugh, because some of this stuff is not funny, but it can be. And sometimes it doesn't feel like it could be funny, but that's what's gotten me through always in every job I've had, is like find your people. You're not gonna it's not always gonna be perfect where the entire unit or your entire department is best friends, but sometimes it is. But just find your people and laugh it out, or go to happy hour. Shake it off, because it's a lot, and your coworkers they are going to get you through it, because they're the ones who get it. If you're not in healthcare, if you're not working in the hospital, it's like, you can go home and talk to your significant other or your other friends, and they're just going to be like, oh, wow, that sounds crazy. But like, you really need the people who are in there, with their sleeves rolled up with you. Those are your people.
For sure. No, I think that's really good advice. Awesome. Sorry, I think I went off course. I tangented, but I think it was an important tangent, because I think as somebody who doesn't work in healthcare, it's not a question that occurred to me until you guys started talking. And then I was like, you know what? I think this is a really important thing that we need to discuss. So, and I think honestly that we kind of already touched on question 3 about what drew you to nursing, what drew you to healthcare. I think we touched on how you learned about your current field. So I'm going to skip to number 5. What were some of the resources that helped you move from degree to career? I don't know. Is there placement along the way in some of these programs? Because I know that some programs are designed to kind of be a pipeline. But what is your experience with that? And Laura, since you're up front now, do you want to start us off with this one?
Yeah, I think when you get clinical placements, anywhere you get a clinical, most medical careers, I think almost all of them, you're going to have clinicals, whatever they are. And that definitely helps with your connections. I know here we've hired lots of people who were students. That's like kind of who we first look to, because we know how they work. And like I said, I just got placed in peds oncology, and then that's kind of what fits. So sometimes it's just kind of like fate, which is nice because there is so many choices. So you can kind of test things out and see what you like, and then go back to a clinical assignment. Yeah, I think that's my answer. I don't have much more.
No worries. Sounds good. Valerie, did you want to touch on that?
So with our medical assisting program, we send our students out to every clinic, every hospital, every setting we possibly can, anywhere from orthopedics to pediatrics to neurology to the pain clinic. And many of our students, they say, well, I'm not sure if I want to do that. I want to work with peds, but then we end up sending them to neurology, and lo and behold, they fall in love with that specialty. And so I think definitely going out to your preceptorships, your clinicals, is very, very important. And when you do go, to have a very open mind. So yes, you may have an idea of what specialty you want to get into, but if you have an open mind, you never know. You never know what you enjoy. And I've had students who say, yes, I want to do peds. But when they get there, they turn around and say, no, I kind of don't want to anymore. This isn't what I want to do. But again, having an open mind, absorbing as much as they possibly can during their clinicals, and to ask questions. I encourage students to not only show up in their scrubs, their stethoscope, be ready to work, but to also have a notebook and write down questions and also write down the answers. And there's so much you can learn. And this is such a great opportunity for them to meet people who are in the gist of it all, and ask them firsthand how they got to where they're at. And maybe that's where they want to be. You know, maybe their career, maybe being a medical assistant isn't what they want to do. And they meet a PA, or they meet a nurse, they meet a doctor, and their interest gets piqued and the passion just floods in. So to just have that open mind and to ask questions and be very sincere and genuine in wanting to find out those answers. And yeah, and so I think we can apply that to all careers.
Sarah P.
Yeah, so I have possibly, I agree with everything that everyone else said. One other point that I'm going to make and stress, and if you ever meet me in person, come up and say hi and introduce yourself. Your network will outwork your net worth. And what I mean by that is my network, literally, I would come in and I would present with positive affect and just engaging with people and very interested. And I'd find a way to connect with people. I'm extroverted, yes. I have a boisterous personality. And so I can usually connect with people wherever I am. Sometimes I'm a lot for people, and I know that. But I say that to say this, I would try to read the room, and I would find a way to connect with everyone in the room, the janitor, all the way up to the neurosurgeon who was doing, whatever, and just some way to connect. And every single time those folks would come back around and I wouldn't even know, and they'd say, oh, my father is the, head hospitalist, or the head chief surgeon of, UCSD or whatever. And he'd really like to have somebody like you. I'd like to have you meet him. And so I think that, I'm here today because I went and met Dr. Hands and just walked in and said, I don't know you, but I heard all about you and I have to meet you. We have to do something. How can we collaborate to improve, to increase students in health sciences? How can I help? And that's why I'm here today. And so there are opportunities like this. And one day, Kaoru and Julia and Sarah, new nurse Sarah, one day you guys are going to see me and you're going to need some support. You're going to need some assistance, or I'm going to need some assistance, and you're going to be my nurse or my doctor or my respiratory therapist, Kevin, Melody, Huang, Gabby, Eliani, all of you. And so this is where we make those connections in these moments. And that's what has proven true for me, is that I have just made relationships with someone at every single possible moment. And I'm authentic and true. I'm real. I'm a little girl from Southeast, like everybody knows it. But I am authentic and true, and I have a heart. I want to help. So I'm in the right field. It doesn't matter if it's social work. I can help at the grocery store carrying bags out, if I see somebody who needs it. So where there's a need, help. And then you'll be noticed. People are going to see you doing that, and opportunities will open for you. So in addition to the clinical rotations that I did, I also had other opportunities to shine. And I always took advantage of those and built those relationships.
Beautifully said. Sarah S.
Hi. Yeah. So I think, when I knew that I wanted to become a nurse. My whole life kind of centered around the journey of, it was getting through my prereqs. And then after my science prereqs, it was applying to the program and getting into nursing school. And then it was getting through nursing school. And then, yeah, I want to be a nurse, but you don't realize until you get higher up the broad field that can be, So one of my professors told us that, as a nurse, don't ever work in a position that you're not happy in, because there's always, another area of nursing that you can use your degree toward where you can do something that you love. It's such a versatile degree. There's so many, different ways to be a nurse and different ways to help people with, an RN, that you don't even realize when you're getting through school. At school becomes so much of, getting to that end goal of graduating that you kind of go, well, now what, and it becomes kind of overwhelming. There's so many different fields. What am I going to do with this degree? Where am I going to start? And something that kind of helped me, decide where to start and how I wanted to build on that was job fairs for one. So, and when you're in college, there's a lot of career fairs where you can go and you can talk at different booths from all the, representatives from the different hospitals and, dialysis and, a bunch of different fields. And you can kind of get a feel of, what that is, what it would mean to work there and be that type of nurse. A lot of representatives came into our classes from different companies and different hospitals and talked to us, about the positions and the, new graduate nurse programs that they have and what kind of support that would mean to you as a new nurse. So you can get a feel of, do I want to be a part of this company? When I was just finishing third semester nursing school, before going into fourth, I applied for and got selected for a student nurse internship position at one of our hospitals. And, I was able to get my feet into a lot of different departments in that hospital to be able to experience what it was like. I got to do extra shifts in the OR and the emergency rooms. I got to walk with respiratory therapy. I got to work in wound care. So, I kind of got to go, yeah, this is cool, but maybe not, what I want to do, or, yeah, this is really what I want to do. So, those were amazing resources. Volunteering, I did some volunteer work with, community outreach where I could go and work with people more at the community level, and, see if, what you could do for the community, and maybe, you want to use your degree towards that. So there's so many resources in, nursing school and as a new grad to really help you pinpoint what you want to do. So definitely, utilize that. And, I'm starting out at bedside nursing, on a med-surg floor. Some people tell you, that's a great place to start and kind of get some experience, but I also know I don't want to stop there. I want to eventually get to pediatrics, and I would love to get to nurse practitioner. And the great thing about nursing is that there's just no end to growth if that's, what you want to do. So.
Thank you, Sarah, because you guys, I think, kind of answered the next question, which is opportunity for growth. I feel like we covered that and then some, right? Mm-hmm. It sounds like you all have this experience, which is just there is no limit to how you can grow in your career and how you can change and how you can shift your position, what that means, and how you engage with the public. So yeah, thank you all. That's truly beautiful, beautiful responses there. So I'm going to move on to number 8. Sarah, it's kind of a hard place for you to start, maybe, but just curious, how do you feel accepted by your colleagues or in your profession overall? Are there any areas or circumstances that you've encountered that that made you feel imposter syndrome, or like you weren't quite at the level of the expectation, that you felt out of place, anything like that?
Sarah asked me, Sarah.
I just realized I was muted while I was talking to you, but yes, Sarah asked.
Yeah. So to answer that question, definitely yes. I think number one, my entire school career has been, from the bottom up, solely community college. And like I said, I'm a first generation, college graduate in my family. And, when you start at the community college level and build up, I feel like some people, may kind of look down on that a little bit, oh, you didn't go right into a 4-year, or, something like that. You didn't, get your bachelor's right away. The structure my life took, I got married to a wonderful man who's been in the military his whole life, and we had kids rather young. So I had a lot of people tell me, when I was having kids in my early 20s and still trying to go through school, that wasn't possible. You're never going to get there. You're never going to get there in community college. And I can't believe how wrong that was. I met some of, the most amazing professors, including you, and a lot of professors for my, my science prereqs that I am still in contact with, who, really pushed me in their classes, who continued to give me support along the way, even, when I'm across the country from them now and, getting through nursing school. Professors who, I sent messages to, and I did it. And you guys were, so much of that foundation of getting me there. So there's absolutely nothing wrong with community colleges. There's some of the most amazing people that build, the professors and, the foundation of these colleges. And, I was able to apply and get into, a nursing program that was one of the top in the state. And, I have to refocus and see what, where I was going with this. But so even now, when people look at me as a new grad nurse and go like, where'd you go to school? I was like, oh, I graduated from the nursing program in a community college, and it's, one of the top programs in the state from a community college. And when you're in these hospitals, doing clinicals with these other students that are in these, big 4-year, state universities, and I think that there is some degree of being looked down upon because you took the community college route. But, you are getting, still an amazing education. My program had 100% NCLEX pass rate, these last year and a half. So, I think just being proud of where you're at with your education, whether you stay in a community college or you, grow from there, and not letting anybody look down on you and tell you that you can't do it, regardless of, what else you're going through in life, and to not give up, basically. It took me, everyone walks at their own path with their education, and some, get it done real fast and jump right into things, and others, life takes you on a different path, but that doesn't mean that you're less than or failing. It just means that you're doing things in your own time. So I'm in, my mid 30s, and I graduated nursing school, in December, and I'm doing it. I'm living my dream, and I didn't let anyone tell me, that I couldn't because of where I came from and how I got there. So.
Hell yeah. I love that. I love that. It's beautiful. Take as long as you need to get there. Go there your way. I love that. Valerie, did you want to follow up on that?
I'm not sure how I can follow up with that. So, can you repeat the question? Because when Sarah was talking, so many things went through my head.
The question is basically, do you feel accepted by your colleagues in your profession? Are there any times along the journey that you felt uncomfortable, or like you're not meeting someone else's expectation in some way?
Oh yes. The one thing I wanted to say to Sarah was, it doesn't matter. You just keep going, and you keep doing what you need to do, what you need to go through. And, having worked with nurses in the ICU and on med surg and in all different units and different specialties, it does not matter to me whether or not you have a bachelor's or an associate's or a master's or a PhD. What matters is the care that you provide your patient. And so at the end of the day, it is all about the care that you give your patient, and not the degree behind your name and what college you graduated from. I want to make that very clear, because as someone who graduated from a community college, with an associate's in respiratory, it provided me a wonderful education, not just how to do the job, but to how to provide the care to the patient. And so that's really all I have to say about that part. Do I feel respected? Yes. It took a while in the field of respiratory because many people look at it and say, "Oh, you're a respiratory tech." Actually, I'm a therapist, and most of the work that I do is very cerebral. Sure, what they see is us walking in and giving patients little inhalers or writing down numbers on the ventilator. But I kid you not, there came a point where all of us could look at a patient, look at the monitor, and say, we're going to have a situation here, or we can anticipate things. And so it took a little bit for people to really know what the field was and to give it the respect that it deserved. And I think with the pandemic, many people started realizing just what respiratory therapists do and the importance of that profession. And just like with medical assistants, I tell my medical assistants that, hey, you are the face of the medical office. You are the ones making the calls. You're the ones rooming the patient, taking their vitals. The doctors, the NPs, the PAs, the providers cannot do their job without you. So just know that you are more than respected. You are so important to the functioning of the office and of the business, really. So something to be very proud of.
Absolutely.
Yeah.
Sarah P.
So I see I'm cognizant of the time. I'm going to say this just very transparently. I am a 6 foot tall, 270-pound Black and Native American woman. I am very proud of my culture and my background. And I am generally the only one of me in any space that I've ever worked in, ever. So I also have a very unique perspective frequently, and I am unabashed in my sharing of how we can consider communities that might otherwise not be considered. So what that means for me in my current role and in my current job is that my job that I've had for the last five years or so is that I wrote policies for the state of California. I was the only registered nurse epidemiologist that managed the Medi-Cal waiver in the entire state that was like me. And so I wrote policies that talked about demographics and how it is that we're going to be equitable in the provision of services and change the entire state and their outreach for these Medi-Cal programs. I created a Black employee resource group at San Ysidro Health, one of 4 Black women that founded that group. And it's thriving. We're doing all kinds of wonderful things in the community. Me being on this call is a derivative of that work 4 years ago that we did. This is a direct relation because I am encouraging my employer to do outreach to communities of color, to communities that are underrepresented. And so that's why I went and met with Dr. Hands that day and said, hey, you don't know me, but this is what I'm trying to do. And she said, absolutely, let's do this. And that's how I'm on this call now. So it's been in every single room that I've been in pretty much all of my life, all of my career. And I just try to find ways to capitalize on that same connection that I talked about earlier. Try to find ways to capitalize on that. I try to find ways to undermine the negativity that could be associated with me walking through a door. I've had doctors say, hey, who's that big Black girl over there? Who's that big, loud, ghetto Black girl over there? And then I walk over and, and I'm just polite as can be and professional as can be and articulate as can be. And they're very surprised. And these are medical doctors that have said this. I've experienced all kinds of challenges in the workplace, but ultimately I win every single time and my patients win every single time because I find relationships with people who are also going to hold they're going to hold their ground. They're going to say, not Sarah, absolutely not. Nope. She's a star. She's shining. She would never say something inappropriate like that or do that, and it never ever ever happens. So I have allies, I guess is what I want to say. I have closely aligned myself with folks who can be my allies. But that was imperative, because if I didn't have allies, I'm sure that I would not have been able to get as far, being presenting as I am. So that's, yeah, definitely some challenges over the years, but a lot of good that's been done because of it, a lot of good. So Sarah's going to get to be a pediatric nurse because of it. We're going to get, like this is what it is. So does that answer your question?
It's beautiful. Absolutely. Laura, anything to add?
I know we're short on time, but I agree with everyone said, especially therapy, like building your reputation, like it can take a little bit of time, and there's so many egos in healthcare. And there are people who will have their own limitations on themselves and then project it onto you. And you gotta just roadblock and also build up your reputation. Then you have a team of people that will defend you if anyone says anything. But I do remember when I moved out here to go to grad school, I heard some people talking about me, saying that I was too new of a nurse to go to NP school. Like I hadn't worked as an RN for long enough. And I remember I had a nightmare that I was in California. I lived in Missouri, but I was in the dream, I was in California. And I had to serve at the fast food place. Everybody who came up was a different nurse that I worked with. And they were like, "Oh, I heard you moved out to California and tried to go to graduate school." And it was such a obvious, I was clearly thinking I wasn't, not that there's anything wrong with working in food, but that I didn't accomplish my dream. And I'm so glad I didn't listen to those people and that I still went out there and did it, because there is a lot of people who will try to put limitations or say what Sarah S. was saying about, you're not going to make it because of this or your kids or whatever. Just anybody, basically ignore the haters. If someone like Sarah P. reaches their arm down and tries to pull you up, take that arm and get pulled up. If anyone's saying anything else, just ignore it. It is so much more about them than it is about you. And you got it. You can do anything. So
Pull out that yellow raincoat.
yeah.
Right?
Yeah.
I love it. I know that we're into a little bit of overtime, but if you could all just each maybe give one last summary of advice that you would give to students, cautions, recommendations, tools. Laura, start with.
I think I said that was my advice. Don't listen to the haters. Yeah, that's it. And if you want to go into in any kind of humanitarian aid, you can email me or Sarah P, because it is a totally different world and there's a lot to be said, but it's so separate. Then it is such a different world. So I think that's another conversation.
All right, wonderful. I appreciate if anybody would like to put their name, email rather in the chat, please feel free. That won't be made public on the internet, by the way, but just for our students. Sarah S.
Yeah, so I think just to summarize, the importance of from start to finish, this is your journey, not anyone else's. So regardless of other people's thoughts and feelings, the path of your schooling and where that schooling eventually leads you and to what career that leads you into is completely, your journey and your choice, and it's your life and what you're going to be doing at the end of it. So that's what matters. Again, everything, is at your own pace. A lot of people are going to have, those setbacks and those things that happen in life throughout your schooling that, are going to make you feel like giving up. And, that dream is still just sitting there waiting at the end. So, just take a deep breath and fight for that dream and keep going. dust yourself off and keep going. There were numerous times in nursing school that life just got so heavy on me that I felt like giving up halfway through. And my two daughters were the ones that wrote me little notes that said, Mom, we don't want to see you give up on your dream, just like you don't want to see us give up on ours with what we want to do when we're older. So don't give up. And I kept going. And, that moment of graduating and starting my career that I had worked so hard for, and so many people had said that I wouldn't get to, was, one of the brightest moments of my life. Definitely utilize resources, as I said. So many of the professors that helped, walk me through my schooling, like others had said, there were certain classes in my, science prereqs that I struggled with. I struggled with chemistry. You were one of the first professors that, actually made chemistry understandable for me. And I did, that's the class I had to repeat. And with you, I passed it. And some of my, math classes I needed, it was hard for me. I had to repeat them, but I didn't give up. So, even if you're, struggling to get through something, use your resources. I made a lot of great relationships with professors along the way and throughout nursing school. They want you to succeed. They want to impart wisdom to you. They want to, root for you. So those relationships, I think, are very important. And yeah, I think that's what I got.
I saw Sarah P. put some comments in the chat there. So positive relationship fostering, and go forth and do good. I love that. Anything else that you want to add to that?
I tell everybody every day, John Lewis used to say, the time is always right to do what's right. And that's literally how I just live in that space. I want to do good. I want to be the very best that I can every day. I have dark, sad days, frustrating days, challenging days, but overall, I want to do good. That's what I go into work for. That's what I do. When I walk out the door, I leave the house with the goal of doing good. And some days it goes better than others, but I want to do good. So just a mindset and create those relationships, guys. My email is there. Feel free to reach out to me. My nickname is the Black Yellow Pages. So if you need to know anyone, if you're trying, and I'm talking about, even if you're non-Black, if you're trying to create a program for something or do something, or you want to get, some Black nurses involved or Black social workers involved, or, psychologists or tap me, let me know. I know somebody who knows somebody for sure. So whatever that looks like, make sure you just reach out, and I'm happy to support you in any way I can.
Beautiful. Thank you so much. Valerie?
Wow, so much wonderful advice given by our panel. One thing I want to add is, in addition to using your resources and knowing that your professors really are there for to help you and to help you succeed and get you to that goal of yours, whatever it is, that is the one thing I want to add is to be gentle with yourself. We're all going to have really, really rough days. And our biggest critics are ourselves, regardless of all the haters out there or all the negative talk that's out there. Once it gets into our head and in our heart, that's when our dreams stop. So be gentle with yourself. If you didn't pass that chemistry test or that chemistry class, it's okay. Take a moment, breathe, figure out what led you to not passing that class. Work on that. Maybe you don't know, the chemical names. That's a major part of it. Figure out what the issue is, work on it, and then you can move on. And don't be afraid to ask for help. Again, the professors are here. It's so funny. My students, they want to come and just hug me and buy me gifts. I'm like, no, stop. And they say it's because in our program, we're a family and we love everybody and we want everyone to succeed. And so, again, we want you to succeed. Be gentle with yourself. If you need help, just ask.
Beautifully said. And I put my email in the chat. I completely agree. I think when wonderful people like Sarah and like Valerie say that they want to help, take them at their word, right? Allow them to do that for you, because that is how we move up. That's how we find what we're looking for. So wonderful. Thank you all so much for your time. Not to be favorite, but I've done a lot of these panels and I think that this one was truly spectacular. So thank you for your time. Thank you for your words. And have a wonderful, wonderful evening. And thank you to all of the students who came and participated with us. It was really, really nice. So thank you.
Thank you.